ibuprofen or ibuprofen. So this is an NSAID, a non-steroidal anti-inflammatory drug that is commonly used for treating inflammation, fever, and also pain. So what are the indications for or uses of the drug? Firstly, it's pain relief. Example, headache, migraine, dental pain, period pain like dysmenorrhea, rheumatic and muscular pain, and also backache. And also it relieves fever associated with cold and flu. So for administration of the drug, this drug should be taken with food. Contraindications of the drug: hypersensitivity to ibuprofen, aspirin, or the other NSAIDs, non-steroidal anti-inflammatory drugs. Anyone with active or history of peptic ulceration should avoid this drug. Patients who have undergone coronary artery bypass grafting surgery and also revascularization procedures should avoid this drug. Patients with severe heart, renal, or hepatic failure, and also patients in the last trimester of their pregnancy. So special precautions. So precautions should be taken in the following conditions. So discontinue use at the first appearance of skin rash, mucosal lesions, or any hypersensitivity. Previous history of bronchial asthma or allergic disease, SLE, mixed connective tissue disease. All of these patients should take the ibuprofen with care. Renal impairment, hepatic dysfunction, hypertension, heart failure, long-term high doses treatment, history of gastrointestinal disease like ulcerative colitis, Crohn's disease, exfoliative dermatitis, Stevens-Johnson syndrome, and then we should also be careful if the patients are taking concomitant oral corticosteroids, anticoagulants, selective serotonin uptake inhibitors, so these are the antidepressants, and also the antiplatelet drugs. Also try to avoid concomitant or concurrent use of NSAIDs, including the COX-2 selective inhibitors such as celecoxib. So use in pregnancy and lactation. The use of ibuprofen during pregnancy should, if possible, be avoided during the first 6 months of pregnancy. And it should not be used for the last trimester of pregnancy as mentioned previously, because there is a risk of premature closure of the ductus arteriosus of the fetus and also possible persistent pulmonary hypertension. And patients who take ibuprofen may have their onset of labor delayed and the duration increased with an increased bleeding tendency in both the mother and the child. In limited studies, ibuprofen it appeared in the breast milk in very low concentration, and it is unlikely to affect the breastfed infant adversely. Adverse reactions or unwanted effects of the drug: stomach discomfort or pain, indigestion, nausea, gastrointestinal intolerance, and then gastrointestinal bleeding, stomach ulcer, activation of peptic ulcer, black tarry stools, rashes or worsening of asthma, liver and kidney problems, headache, and also dizziness. So these are some of the unwanted effects that could possibly be seen in patients who take ibuprofen. Drug interactions. It has been shown to inhibit effect of low-dose aspirin on platelet aggregation. So the wanted effect of aspirin to prevent aggregation of platelet might not be seen when in patients taking ibuprofen. And then there is increased risk of adverse effects with other NSAIDs, obviously, including the COX-2 selective inhibitors such as celecoxib. There is increased risk of gastrointestinal ulceration or bleeding with corticosteroids, antiplatelet agents, selective serotonin reuptake inhibitors as mentioned previously. And then there might be diminished effects of antihypertensives. You might not see the full effect of the antihypertensives when taking ibuprofen. And then you might see increased nephrotoxicity by diuretics, cyclosporine and tacrolimus, and enhanced anticoagulant effect. Okay, so it might cause bleeding, increased plasma glycoside, lithium and methotrexate levels. So methotrexate is a disease-modifying antirheumatic drug. Lithium is usually given for bipolar disorder. Glycoside is usually for arrhythmia. And then reduced effect of mifepristone, which is given to induce abortion. Increased hematological toxicity with zidovudine, which is an antiretroviral or anti-HIV drug. And then there is increased risk of convulsions, fainting, seizures associated with quinolones, okay, which are the group of antibiotics such as ciprofloxacin. So that's all for ibuprofen. See you people next time.